AI is just one of many different branches that science can go. And what's really interesting is that anytime there's a discovery, it gets shared very quickly at conferences like AACR.
Welcome to Believe in Progress, the American Association for Cancer Research Foundation podcast. Join us and be inspired by the incredible stories of those who have faced cancer with strength and resilience, and the medical professionals who are working tirelessly to find new treatments and ultimately a cure. Believe in Progress isn't just about the science of cancer. It's about the human side of this disease. Together, we can make progress in the fight against cancer and bring hope to those who need it most. Welcome to Believe in Progress, a podcast from the American Association for Cancer Research Foundation. In this special series recorded live at the 2025 AACR Annual Meeting in Chicago, we're bringing you powerful conversations with researchers, clinicians, survivors, advocates, and thought leaders, all united by one mission: to accelerate progress against cancer. Across this series of episodes, you'll hear from voices at the forefront of discovery and innovation, sharing stories of science, strength, and hope. Whether it's groundbreaking research, lived experiences, or visionary leadership, each guest offers a unique lens into what progress looks like and why it matters. Let's get into today's conversations. Joining us now is Dr. Marija, Plodinec, CEO, board member, and co-founder of ARTIDIS. Dr. Plodinec leads the charge in bringing a groundbreaking cancer diagnostics technology from the research lab into everyday clinical use, with the goal of transforming the way patients experience diagnosis and care. I had the great pleasure of being introduced to Marija by Foundation board member Dr. Ajit Singh the other night, and said we'd love to spend a couple minutes with you so you could talk to our audience a little bit about yourself and a lot about your company. So Marija, welcome to Believe in Progress.
Hi, Mitch. Thank you so much for inviting me to be part of this great podcast. Yes, so my background is really actually originating in physics. I did my undergrad in physics and PhD in biomedicine, which at the time was not so emergent as it is today, because when we look at this conference, for example, this week, we have seen number of talks, plenary talks, lifetime award achievements that combine physics, bioengineering, tissue mechanics, and cancer biology. And so this is where my scientific career actually originates. I did a PhD at the University of Basel in Switzerland. And the technology that we're going to discuss today a little bit about actually was developed during my PhD time at University of Basel.
And where's that accent from? Where are you from?
I'm Croatian. I'm
okay.
Croatian. So I'm a mix of all worlds. Born and grew up in Croatia, did my PhD in Switzerland, and now spending a lot of time in US.
And where do you live in the US?
In Houston.
Oh, you do?
Okay. I commute between Basel and Houston. It's an interesting
That's
commute.
not a bad commute, right?
It's a long one.
So tell us a little bit about the company, and it's a relatively young company, right?
Yeah, so ARTIDIS was founded end of 2017, and since then we really not only developed the technology, but also established very strong clinical collaborations, both in US and Europe. And I'm quite proud to say that one of our strategic partners is MD Anderson Cancer Center in Houston. We work also with Baylor College of Medicine, and we are currently expanding to a number of other sites in US. And ARTIDIS, at its inception, the goal was to bring physics to cancer care. And when we say physics to cancer care, what do I mean about it? Pretty much every imaging modality that we use in oncology actually did originate in physics. But now we're taking it really to a new level, because technology behind ARTIDIS is so-called atomic force microscopy. And at the heart of the technology is a very small nanosensor that really comes into a direct contact with unperturbed native tissue, and it can probe all different locations in a tissue biopsy at unprecedented resolutions. So we see in mechanical properties of individual cells, be it epithelial cancer cells, be it fibroblasts, be it different types of immune cells, as well as the matrix structures that surround those cells. And that information helps us to understand how aggressive potentially the tumor is and how we can best treat it. And what do I mean by that? We think a lot about genomics, all different types of proteomics, all different types of modality, but one of very important aspect of cancer progression and metastasis are really physical characteristics, because if a cancer cell is not deformable enough, it cannot leave the primary site. It's not going to kill you. So that physical feature is critical both to measure as well as to try to intercept with different therapeutics. And as of today, we are not really deploying this in clinics. So that was the motivation behind ARTIDIS when we started. And I'm happy to say that meanwhile, we have validated our technology in more than 1,000 patients globally and currently run global prospective multicenter trials in over 4,000 patients.
And it's literally a tiny sensor, just
Very
one
tiny.
one sensor.
Just one sensor.
So it goes on the hand.
No, it doesn't go on the hand. It goes on a tissue. So we require a tissue biopsy. So how ARTIDIS works, it's really part of interventional radiology or imaging procedure.
Yes.
And as a standard of care, in order to confirm cancer diagnosis, you need to take a tissue sample.
Yes.
And that tissue sample is directly from a biopsy needle presented into the device, and then those little palpations measurements occur in a liquid environment. So we completely preserve the integrity of the tissue. And at the same time, we provide information about deformability, adhesion, or elasticity.
And is it for all cancers or is specific to certain cancers?
So our focus right now is really on solid tumors.
Yes.
We can technically measure also hematological malignancies. There's no limitation from the technology side. But why focus in solid tumors? Because that interplay between cancer cell mechanics and the tissue microenvironment is really critical. And we also know that from all the therapeutics that are currently being used to address the tissue microenvironment. So the unmet need is really to have a predictive biomarker which will tell us which of these therapeutics will be favorable to patient outcomes.
So you're the co-founder, right? How did this idea come about? I mean, did this come about in your head there, or was it a few people that came up with this thought?
So the concept of tissue mechanics existed before I started my graduate studies, but the idea to use atomic force microscopy in this particular way to measure tissue properties and use it for cancer diagnosis and planning of treatment, that was really my idea in the group of Professor Uliabi in the University of Basel.
And is that physics?
Yeah, so the physics of it is really a breakthrough, because we can, through measuring physical characteristics only, have information about cell biology.
Yes.
And then I think that is really fascinating. And at the same time, it is also clinically actionable. And what I mean by saying that, every cell has very specific structures, different cytoskeleton components that allow a cell to divide, to deform, as we said, to migrate, to intravasate, extravasate. All of those properties are critical for cancer spread and metastasis. And having the ability to use a very fine nanosensor to measure that in a patient biopsy, just right there in a suite where you are performing the procedure, is something very unique, because now we have to send samples to a central lab where they're processed either for immunohistochemistry or other types of molecular analysis, which are very insightful but are cumbersome to perform on one hand. And on the other, those types of analyses do not provide complete picture about the tumor phenotype. How are these structures actually assembled within a tissue in order to enhance tumor progression? So we really measure those phenotypes. That's why we call our technology a nano-mechanical phenotype platform.
Interesting. What are your hopes for the company?
We are right now a clinical stage company in the midst of our clinical trials. We hope within 24 months we will have first results that will allow us to go commercial. And this is a first step towards bringing this technology broadly both to the patients and providers. And midterm, we see ARTIDIS as a part of standard of care in every clinical setting where a tissue biopsy will be performed and there will be decision making on patient treatment. They will deploy ARTIDIS.
So this is something that has to be FDA approved?
This absolutely needs to be FDA approved. ARTIDIS is a new type of technology, and it has been recognized by the FDA as a de novo medical device.
Yes.
Which means we do not have a predicate, and we are currently going through the clearance with the FDA. We hope that in the course of this year, we will be cleared.
And tell me a little bit about your thoughts about AACR, this wonderful meeting that we're having here. I know you're very, very busy, but have you had any chance to see any of the sessions? And how does that help you?
It has been a fantastic experience for the past 2 days. Seeing that one of the plenary talks by Joanna Joyce was on tissue microenvironment in glioblastoma, delineating that role of tissue fibrosis and scarring in tumor progression and resistance to treatment. And at the same time, knowing that with ARTIDIS, we directly can measure those characteristics and help guide some of the treatment decisions in these areas has been very exciting. Rakesh Jain just got yesterday a lifetime award. He has spent his whole career working on understanding how physical characteristics of tissue contribute to angiogenesis, interstitial pressure contributes to tumor regenesis and treatment resistance. And so I feel that the field is ready to talk more about these new types of features that we are also measuring with ARTIDIS. So it has been very exciting for us. Number of talks around neoadjuvant setting. This is truly becoming an emerging modality for treatment of pretty much every solid tumor. And also we see that it's moving towards earlier stages. The contribution to the patient successful outcome is probably the highest. So in that regard, I think it's been a fantastic conference. I don't believe I mentioned earlier, but one of the key applications of our technology, since it's being used at patient bedside, is really to measure the baseline tissue biopsies before neoadjuvant treatment and trying to predict that first line treatment in a way that first treatment is successful for the patient. So we don't need to escalate to second and third line, or at least try to minimize that as much as possible.
Or are you doing anything with pediatrics?
Not right now.
Okay.
Technically, there are potential use cases in pediatric cancers. I think as we move forward, also with our clinical partners, we will see where are the right opportunities and areas with the highest unmet clinical need. But from the technological point of view, there is no limitation.
Yeah, fascinating. Tell us a little bit about our own Dr. Singh and Dr. Singh's involvement in the company. You know, Dr. Ajit Singh is one of my favorite people. I love getting his annual reading list at the end of the year.
Oh, absolutely.
He always sends that out. But fascinating man and very passionate and very caring. And I feel blessed that he volunteers and serves on our foundation board because we get a lot of wisdom from him. But tell us a little bit about his involvement with the company.
Well, thank you for sharing this because I truly feel the same. I got to know Ajit through a common friend a few years ago now, and you know, it was a scientific love at first sight because Ajit is also has an engineering background.
Yes.
Has spent a significant part of his career working in radiology and radiation oncology. And so we immediately dived in all the nuances of engineering and biology and tissue mechanics. And we share love and passion for good literature, for good art, and good food and wine. So,
Yeah, he's
so this
very-
is where all the ideas emerge.
It's Perfect for that, right?
Yes.
Perfect for that. Well, it was fortuitous that we got the opportunity to meet you, and I think the technology and the company is fascinating, and I only wish you the best success, and hope you continue enjoying the AACR annual meeting, and hope to see you back for many years. And more importantly, I hope your work is gonna it is I'm confident it is going to help many people.
Well, thank you very much.
Dr. Plodinec, thank you for your leadership in pushing the boundaries of innovation to improve the cancer patient journey, and for showing how science and compassion can come together to drive real progress. We're joined now by Dr. Andrew Chapman, the director of the Sidney Kimmel Cancer Center at Jefferson Health and executive vice president of oncology services. With decades of leadership in cancer care and research, Dr. Chapman is at the forefront of delivering innovative, personalized treatments while expanding Jefferson's impact across a growing network of facilities. We're honored to have you here, Andy. I'm so happy to have you join Believe in Progress and be here at the 25 AACR Annual Meeting. Welcome.
Thank you, Mitch. It's an honor to be here.
Love for the audience to learn a little bit more about your expertise and the kind of research that you've been conducting over the years.
Wonderful. Yep. So I really got interested in health services research through care delivery, and understanding that the healthcare delivery system, in the United States, I felt was very fragmented, and that there was a lot of issues then in trying to deliver care efficiently, both from the standpoint of quality and safety, and then also from the standpoint of cost. And as I was working through to develop programs within the Department of Medical Oncology, I began to realize that the most vulnerable group, I thought, was the older adults with cancer, that they really had so many vulnerabilities that put them at risk in terms of the way that care is being delivered. Thinking about things like if they're on a fixed income, if they're socially isolated, how are they affording their medications? How are they getting to their appointments? If they have issues with regards to taking medications, because cancer therapy is very complex. So that really got me on this path of models of care delivery for older adults with cancer. That was really sort of the spark that really got ignited within that area of vulnerability.
And when was that?
That was probably about, say, 16, 18 years ago.
And were you at Jefferson?
I was at Chapman.
Really?
Yeah.
And where were you prior to Jefferson?
Oh, I was there.
Oh, okay.
Yeah, I was there. And, I was practicing as a, medical oncologist, hematologist, and was primarily interested in heme malignancy patients and lymphoma and myeloma as the operations piece came into focus, because I served in various different roles as a division director in the Department of Medical Oncology, and then as a vice chair for operations, and then ultimately building out the service line as the health system was growing across multiple different hospital systems that were coming together. And so during that period of time was really when this interest in health services research, had evolved. Prior to that, the work that I had done many years ago was, in the lab in terms of working with microtubules.
Mm-hmm.
And that was, basic science,
Mm-hmm.
research when I was a fellow. But the health services research piece really kicked in at that point.
And Jefferson has really been aggressive in its growth strategies over the years. And as the leader of the cancer center, tell us a little bit more about what's going on at Jefferson and some of the things that you guys are really proud of there.
Yeah. So look, I would say first of all, I'm really proud of our leadership. I think that they really understand the importance of delivering high quality, safe care, not just cancer care, but care to everyone throughout our region. And I think my mantra to the folks in the cancer center is that regardless of where someone comes through the door of the Sidney Kimmel Comprehensive Cancer Center, they're care needs to be of the highest quality, safest care for every patient. And they need to have full access to all of the resources that the Cancer Center has available. And so that's been a driving force. So we're really proud.
You live up to that culture too, because
We do. I mean, it is, it is a constant, work in progress.
Yes.
I mean, as you said, the health system has expanded rapidly, over the past 10 years. We're now up to 32 hospitals. And so it's, it's constant work to be done, but, that's the passion. The passion is that everyone deserves, access to the highest quality, safest cancer care.
Here we are in Chicago at the annual meeting. Tell our audience a little bit why this is such an important place to be right now in science, and even someone with your great esteemed background, what do you get out of this meeting?
Every time I come to AACR, I learn an amazing amount of things. I think that that AACR for 100 years has been a convener of these breakthrough discoveries. And so to me, this is an incredibly exciting place to be. And, I'm oftentimes attending, symposia that I don't work in, and seeing these brilliant people who are really making these incredible discoveries. I think it's energizing. So I love it. I think the other thing I would go to is I loved what Dan Von Hoff said last night.
Tell the folks a little bit who Dan Von Hoff is.
Dan Von Hoff, is just one of the esteemed, really just leaders in cancer research for decades, and experimental therapeutics. I mean, he's really an icon for us. And he was honored last night,
right,
as you know, in your in the Partners for Progress. And he said he characterized AACR so well in saying that this was a home.
Right.
This is a place where he always felt he had a home to collaborate, to work, and it always grounded him. And I thought he pulled that together so well, and I think it spoke for how all of us really feel. He also happened to mention about the advantages of being short, Mitch.
Right.
And I really liked that.
You and I can resonate to that, my man.
And I really liked that. I said, you know what? It's an advantage to be short. I love this. So that was a fabulous night. But I think AACR is a home for just these brilliant scientists, and it's exciting to be here.
And some of the folks from Jefferson, they make a point to come to AACR to
Always.
learn,
Always.
and present and
Yeah,
do things.
we have a number of posters,
Mhm.
oral sessions, and so I mean, this is a premier organization, the premier meeting,
Mhm.
each year for cancer research, and so we're always here.
As a leader, does that make you proud? Obviously, when you see some of your younger people presenting and doing
It does. We do a couple of things. I go to all the presentations. I go to all the oral sessions. We went yesterday. One of our surgeons, a PhD candidate in her lab presented. She did great. It was wonderful. We go to all the posters. We like to see all of the presenters, and I think that it's exciting. It's exciting for them to know that not only is their work being recognized, by their colleagues around the country, around the world, but also that the people that are leading their center, that they care enough to come and spend time with them, want to know what they're doing, and also want to acknowledge the hard work that they're putting out there. So it was a great time. We're going to do a poster walk this afternoon.
Oh, cool.
After this, we're going to do we have a few more presentations.
What's a poster walk?
We're walking around
Okay.
our posters in particular, and there's other things of interest, but we will walk specifically to see everyone from Sidney, Kimmel, and see the work that they're doing.
That's really cool. What do you think the biggest challenges are in our field? What are some of the things that we need to overcome to continue to make impacts? I mean, I talk to families all the time, and they're obviously always looking for when's the cure going to come for this or for that.
Sure.
What are the biggest challenges we have, Andy?
So I'm going to be very selfish, and I'm going to talk about geriatric oncology, but I think it's relatable to exactly what you're asking. I think that the demographics are showing us that survivorship is expanding significantly, and that's a testament to all the work that's been done and the discoveries that have been made. So now we have a huge population of survivors. And what we also know a lot about is that there are effects from treatments that can affect survivorship. It's been termed treatment-induced accelerated aging. And so I think that the understanding at the most basic levels in terms of what's happening to the cell and what's happening all the way through in terms of ultimately the effect of that therapy is really key, because at the end of the day, with more people surviving, we want them to be thriving in that survivorship. And so I think that's a really, and frankly, Marge Foti has recognized this. She is a strong supporter of the aging and cancer research efforts. And I can't probably thank
we have a task force, right?
We have a task force,
Yeah.
and I can't thank AACR enough. We had a meeting this morning.
Yes.
Wonderful, 50 people came together to talk about this important, emerging area. And that's basic scientists, that's population scientists, clinical trialists across the board. So really team-based approach to these difficult problems. And, AACR is convening this. So I can't thank you guys enough.
Well, thank you for participating. And you do some other volunteer work within AACR. We were talking a minute ago. I think you sit on a committee for our annual progress reports too, right?
Yes.
Yeah. And
Yeah.
what could you tell us a little bit about that?
So, really important, is to be able to, educate across the board, what are the significant discoveries, developments, in cancer research, and what are the, future steps. And so this progress report is a very important report, I think, as you know, that is used nationally to educate all across the board.
It's used a lot on Capitol Hill as well.
Capitol Hill,
to educate
sure.
people.
Yeah. So I think it's really, and it's an honor to be asked to be a part of it.
Because of you, Jefferson has been a great supporter of AACR financially as well as a donor. You've supported our 5K run, our runs, our marathons. You've had the pleasure of holding the tape, the finish line of one of the marathons, I think.
Yeah.
But this guy's also a great runner and has participated in the annual meeting 5K for a number of years.
Yep.
2 years ago, we ran together. This year, Andy tried to coax me in running with him, but my knees were like, I had to go a little slower than Dr. Chapman. But you've raised a lot of money for us, and I hope you enjoy that experience, being part of that.
I do. I think that this is a wonderful organization, and it plays a critical role in terms of cancer research, both in the United States and globally.
Well, being from Philadelphia and being right there and watching what you do and the leadership and how people react to you. We're so blessed to have you in our community and doing the kind of work that you do and the impact that you make. It's great to call you our friend and to see the folks from Jefferson around. It's really remarkable stuff, Andy. So really appreciate what you do for everybody.
Well, thank you. Thank you for having me. And the friendship continues.
Absolutely. Great pleasure. Dr. Chapman, thank you for the work you're doing to advance both cancer research and patient care, and for helping to lead the way toward a future with better outcomes and more hope for every patient and family facing cancer.
Hi, everyone. This is Mitch Stoller, Chief Philanthropic Officer at the AACR and the host of Believe in Progress. I hope you're enjoying today's episode. I wanted to take a quick moment to remind you that your support is vital in our fight against cancer. As we always say at the AACR, cancer research saves lives, but we cannot do that without the generous support of people like you. If you're moved by the stories and insights shared in our podcast, please consider making a donation to AACR by visiting aacr.org. Your contributions help fund essential research and provide support to those affected by cancer. And while you're here, don't forget to subscribe to the Believe in Progress podcast. By subscribing and sharing with your friends and family, you help us reach more people with these important conversations. Thank you for your support. Now let's get back to the episode.
Joining us next is Israel Weiner, a pre-med student and math major at Yeshiva University. With roots in Memphis, Tennessee, and research interests in spanning both cancer and Parkinson's disease, Izzy is deeply committed to advancing scientific understanding across multiple fields. He's preparing to apply to medical school this spring with his sights set on a future in medicine and research. Welcome to Believe in Progress. So happy to have you here. Could you tell us a little bit about your experience here at AACR so far?
Oh yeah, this has just been the most amazing experience. I mean, first of all, the exhibitions have just been so awesome. I get to interact with so many scientists, people who are heavily invested in the biotechnology field. It's just been the most awesome experience getting to see so many different aspects of cancer research and all the amazing work that's done at the AACR.
And you already applied for medical school?
No,
or you're in the
actually,
process?
I'm applying this spring. I get my MCAT scores back in a week from now.
Okay.
And then after that, I will
So
apply.
we're anxiously awaiting that.
We are more than anxiously awaiting that.
And what's your interest in research? Why do you have such a special interest? Cancer, Parkinson's disease?
I mean, I feel like there's just so much more for us as a human civilization to know. I mean, the scientific world is just so vast, and any small, I guess, contribution that we make to this, to research, can greatly improve the lives of everyone around us. So I think it's just a responsibility I have with my background to apply my talents to research and see what I can do to make this world a better place.
Cancer's affected my family, and I have a brother-in-law that's currently dealing with Parkinson's disease. So we'd be happy to have you come in and make a big impact. Have you had interactions with some of the scientists here, some of the cancer researchers here at AACR?
Oh yeah, from the first second I got here, my goal was just to interact and meet as many people as possible. So I have just been bouncing around every single exhibition, every single station possible, just to talk with as many people as I can before I leave.
And you've actually presented here, right?
Yeah.
Could you tell us a little bit about that?
So I had my poster presentation yesterday.
Yes.
I presented on my research is studying DNA protein histone interactions in KRAS.
Yes.
And so I presented that yesterday, and I think it went pretty well.
People around you and asking you questions?
Yeah. My voice was basically shot by the end of it.
That's fantastic. That's
Yeah.
great. That's great. Well, listen, it's a pleasure to have you here. We're so excited to see basically the next generation of scientists, and that's what you are. And going to wish you the best of luck with medical school and everything you have in the future. So thanks for giving us a couple minutes of your time
Thank
today.
you so much. Pleasure to be here.
Thanks. Our next guest is Isaac Silverman, a recent graduate and valedictorian of Yeshiva University class of 2025. Isaac's been conducting bioinformatics research on colorectal cancer, exploring critical pathways involving KRAS and PRMT5 proteins. He's attended the AACR Annual Meeting 3 years in a row and continues to pursue a career where research and medicine intersect. Isaac, welcome to Believe in Progress. AACR meeting 3 years in a row?
Yeah.
So you were in San Diego last year?
Yeah, San Diego and Orlando before that.
Oh, fantastic.
Yeah.
So tell us a little bit about yourself and what your interests are in the research that you're doing.
Yeah, so I'm from Brooklyn, New York. I just graduated now, like you said.
Congratulations.
Thank you. So the research I got into was a few years ago, like basically a few months before the AACR in Orlando, my first one.
Yes.
So it's bioinformatics research.
Yes.
So I work in the lab of Dr. Ritashri Mitra at Yeshiva University.
Yes.
So she was first getting started with like a bioinformatics in silico approach at the time. So I really helped like lead that start of that lab. And so we're really looking at in colorectal cancer specifically, those proteins, KRAS and PRMT5, which are both big oncoproteins that have a lot of effect in cancer growth.
Yes.
So what we're doing is looking through molecular dynamic simulations, which basically tells us the specific interactions between those proteins with other proteins that are in like important pathways and how they go about creating like cancer growth. And so by doing that, we're really able to like pinpoint specific parts of those pathways that we're able to then now target for future therapies and future ways of stopping the growth of cancer.
How did you get interested in this? I mean, just getting interested specifically in bioinformatics, and then obviously you kind of got attracted to the colorectal cancer, but talk a little bit about that.
Yeah, so in high school, I actually was like the president of my coding and engineering clubs.
And where was that?
That was Ramaz,
Okay.
Ramaz High School. So that's on the Upper East Side
Yes.
in Manhattan.
Mm-hmm.
So I got really into coding and engineering.
Yes.
And so now like there's this opportunity, this new laboratory exploring bioinformatics. And I felt like it was going to be a great way to like see how technology combines with the field of biology, because like I was also interested in pursuing a career in medicine, and so this was just a great like intersect between my interest in like coding engineering plus now biology. And so like the interest in like colorectal cancer specifically, so I mean, I have like some family history of not just colorectal cancer specifically, but my mother and like several of my grandparents had like a lot of good experience with like cancer treatment, and so like being a part of the field and like being part of like this amazing conference and like seeing all the amazing work that's being done, I'm just proud to be a part of it.
So 3 years at AACR, tell me, what are you taking out of these meetings?
Yeah, no, so I'm really excited. Like all the times I've been presenting my posters, it's been amazing to speak with like such amazing representatives from all over the world. Like I really do like learn as I'm presenting.
Yes.
Like,
really?
Yeah, like even there's things that like I didn't know specifically about like these certain proteins, because KRAS and PRMT5 in specific are very popular for studying. And a lot of these experts have really great insight on like these new ways that I could take my research. And so that's just been a really amazing experience, because like every time I come here, I go back and like I alter my methodology a little bit and like see how else I can like push the boundaries. Thank you.
Do you go to sessions? Have you gone to some other scientific sessions here as well?
Yeah, no, I've gone to like some of the plenary sections. This year I haven't gone to yet. We're planning on today, because we presented yesterday. I presented my poster yesterday. I remember actually 2 years ago in Orlando, there was a whole session discussion on RAS, like which is like the family of proteins like KRAS, which I'm like studying. And so like they even approached it from a whole different angle, which gave me like a new way of seeing it.
And as you get into medical school, what do you think you want to pursue? Do you want to stay in this area?
Yeah, I definitely want to like explore oncology. I've shadowed some oncologists in the field, seeing the clinical side of it. And like I also want to like pursue maybe MD PhD. Also, if not that, then at least like continuing to do research work in whatever field that I go into.
So ladies and gentlemen, this is the next generation of cancer scientists. This is why we ask you to make donations to the AACR, because right here is the future. We're very seriously about supporting the next generation of cancer scientists. So keep at it. Keep up the great work. Proud of what you're doing in the poster sessions. And
Thank you.
Do you have another poster session today, or that was yesterday?
That was yesterday.
Okay, and you had a great crowd around you as well.
Definitely, I was out of breath. I kept.
You were.
I had to keep drinking water. It was like a non-stop. I got like maybe one break in the entire 3 hours.
That's great. Well, listen, great honor to have you here today. Thank you so much for giving us a few minutes of your time.
Yeah, of course. Thank you for having me. Thank you so much.
Our final guest in this segment is Aaron Shakovich, a driven BS MD student heading to SUNY Upstate Medical University. Aaron's interests lie at the intersection of medicine, public health, and economics. His work reflects a passion for using research to inform healthcare policies and improve outcomes on a broader scale. Aaron, welcome so much to Believe in Progress. We're honored to have you here today. And I understand that you were a recipient of a Scholar in Training Award. Could you tell us a little bit about that?
Sure, of course. So I received the award from the Debbie's Dream Foundation.
Yes.
So their organization specifically cares to target and treat stomach cancer. So our research specifically looked at specific protein ZNF469, which we believe has prognostic and diagnostic significance in colorectal as well as stomach cancer. And so what's really interesting is that our lab primarily was a colorectal cancer lab, but the findings we found additionally in stomach cancer, and that's where they might be able to have a very significant impact.
Was this getting the award, getting the Scholar in Training Award, which helped you with your travel, is that meaningful for you?
I think the most meaningful part was meeting my sponsors and meeting the other awardees. It's really a great experience to learn from people really on the ground. So in Debbie's Dream Foundation, the chair members and the staff there survived stomach cancer, and or they have loved ones who had stomach cancer.
That's pretty meaningful to you, I'm sure.
Yes, of course. So just hearing their stories, it helps me even guide what I would want to do for research, just so that I can make a difference practically on the ground. And so that was very meaningful. And as well, just the support, it just shows that, and the support from Debbie's Dream Foundation, it shows that there are people out there that care about cancer research and care that we are trying to actually make a difference in diagnostics. And so I found that very inspiring.
That's great. Is this your first AACR meeting?
This is my second one.
Okay. Were you in San Diego last year?
Yeah.
And what are you getting out of this meeting this year?
For me, it was great to see like all the technology advancements that there are, both in AI as well as with different wet lab techniques. I'm seeing these great machines that I'm really impressed with. And then also the posters, there's these introductions to some really cool techniques, both in the wet lab and also some softwares that I think are really
So
interesting.
we're hearing a lot about AI and how it's
Mhm.
going to be a big player, and I'm sure it's something that you're probably really interested in.
Of course.
Yeah, and you're seeing. Do you utilize that now in the work that you're doing?
I think it's something I'm interested in getting into.
Okay.
I haven't really had the chance yet to start on that yet, but I think that AI is just one of many different branches that science can go.
Mhm.
And what's really interesting is that anytime there's a discovery, it gets shared very quickly at conferences like AACR.
Yes.
And then that's where everyone can really see, oh, I could take AI and apply it to this really specific situation or a question I have.
Mhm.
And that's where I think it'll really shine.
And tell us a little bit about your journey. Where are you at right now, and what are you thinking for the future?
Sure. So I graduated from Yeshiva University last year,
Mhm.
and this year I decided with my gap year to do an MPH at SUNY Upstate, where I'll be starting medical school in
Right.
July.
So you have interest in public health
Yeah.
as well. Talk a little bit about that.
Sure. So originally my research started in a wet lab background, trying to understand more of the molecular components of colorectal cancer. But through public health, I've started to focus a lot more on the social determinants of cancer, as well as improving cancer screening rates. One research project I'm doing, we're focusing on what factors may determine cervical cancer screening. Another project that we focus on is history of one cancer may cause someone to be more likely to have a different cancer.
Interesting.
So just focusing more population-based and on patient health.
Mhm. And where does the economics come into play here? Your
Sure.
interest.
Yeah, so I majored in health economics in undergrad,
Okay.
and I think it's really important to understand, when there are cancer patients who are in medically underserved communities or who have or lower social economic status, there's health outcomes associated with that. And that's something that needs to play into research. If researching a treatment is very meaningful and important, but the treatment really needs to, be accessible to everyone.
Mhm. And has cancer touched your family in any way that's inspired you in a way?
So for me, my grandmother had breast cancer, and it reoccurred a few times, which was difficult. But
Mhm.
now she's healthy, thank God. Cancer research really started from my mentor, Dr. Radhashri Maitra at Yeshiva University.
Uh-huh.
Her passion was really infectious, and it got me. I'm very interested now in genomics and
Mhm.
how genetics play a role in outcomes.
And how important do you think it is to get younger people interested in life sciences?
Mhm.
Because we have a high school program here
Yeah.
today, and we're really trying to inspire young people just to think about life science, get more involved in that. What are your thoughts?
One thing I'd say is that skill building. If you learn the skills in undergrad or in high school, then when you're going for a PhD, you're already halfway there. Half of it is just learning the skills. And then the other half is passion building. If you just stumble into biology undergrad and then you stumble into biology PhD, you haven't really found what drives you. But if you start searching from a young age, then once you're ready to actually do some serious academics and serious research, you already know what you're interested in.
And at a conference like this, is networking helpful for you, like with some of the
Mhm.
more senior investigators and just others, just trying to get feedback and learn from them?
For my poster, when I presented, I got some amazing feedback, and I think that's really that's probably one of the most valuable components of AACR. Everyone wants to help and wants to explain to you, what their perspectives are, and everyone has unique perspectives. So
So
it's a
you'll
lot.
take that and you'll take that back and perhaps, you know, execute on that
Yes.
within your own,
For
like
sure.
your own research.
Not a question. That's why I'm here.
And so you've presented, and then people just start opening up and just asking you questions, and then offer suggestions and things like that.
Yeah, they'll say, have you considered the immune system, but have you considered ZNF469's interaction with other systems? And we haven't. We really should. And yeah, I appreciate that feedback I get.
That is awesome. Well, it's really a great pleasure to have you here. I'm so happy that you got the Scholar in Training Award. I'm happy you presented. Keep spreading the word out to many, many other young people so we can, cancer's it's a big problem out there.
Yeah.
And I think there's no doubt in my mind that with people like yourself, we can do something significant.
Thank you so much.
Special. So thanks for coming out today.
Appreciate it.
Really appreciate it. Congratulations again to Isaac, Izzy, and Aaron for their achievements and for their dedication to pushing the boundaries of cancer research. We can't wait to see the impact that they'll continue to make in the years ahead. Thanks for listening to Believe in Progress, the AACR Foundation podcast. We hope these conversations from the 2025 annual meeting left you informed, inspired, and reminded that every story and every discovery brings us closer to a cure. To learn more, support cancer research, or explore additional episodes, visit aacr.org or search for Believe in Progress on your favorite podcast app. Please remember to subscribe to Believe in Progress on your favorite podcast platform and share these episodes with someone who may need them. Together, we can and we will accelerate the pace of progress against cancer. Until next time, stay hopeful, stay engaged, and remember, cancer research saves lives.